And joining us now is Kathleen McGrory, who's the Deputy Investigations Editor at the Tampa Bay Times, whose writing has exposed a previously unreported spike in the number of child gun injuries, traced the origins of a fatal power plant accident, and uncovered mistakes at a prestigious children's hospital. And her latest article at the Tampa Bay Times is Florida's medical examiners were releasing coronavirus death data. The state made them stop. Welcome to Background Briefing, Kathleen McGrory.
Thanks for having me.
So, Kathleen, why do you think the state made them stop? And when you speak of the state, are you talking about Governor Ron DeSantis?
Yeah, well, when we talk about the state, we are talking, it's the governor's administration, which is in charge of the State Department of Health, which is the agency that's been leading a lot of the charge when it comes to our coronavirus response here in Florida. I mean, I'll back up a little bit. So a few weeks ago, a colleague and I were trying to assess the death toll, trying to get a sense for how many people had died in Florida. And to do that, we started reaching out to some of the medical examiners in the state to see what they were seeing. And somebody suggested to us that we might want to try to get the Medical Examiners Commission list of deaths, that all of the local medical examiners had been sending up to our state capitol in Tallahassee. So we made a request for that and found out that the list that the medical examiners were keeping was actually longer than the list that the State Department of Health had of deaths. And there were a number of reasons that there was that discrepancy, and I can certainly get into that if you're interested. We wrote that story, though, and within between a week to 2 weeks, I went to try to get a copy of that record. Again, the medical examiner's list, and was told that it could no longer be provided to the media and to the public. The state kind of clarified that, and so that they actually do plan to release it at some point, but right now it's being reviewed and may have to be redacted. And it's been about 10 days since I made that request. So, we've really been just trying to get to the bottom of why we can't have access to that list, because we think it's a really important figure for the public to have.
Well, across the country, it does seem that there's an undercount, and nobody quite knows how many deaths are being undercounted. A lot of people are dying at home from COVID-19. And the Washington Post, in partnership with the Yale School of Public Health, recently estimated that there are 15,400 more people died between March the 1st and April the 4th, which was substantially higher than the 8,128 coronavirus deaths that were reported over that time by government agencies. So this is something that I imagine a lot of reporters are looking at. So do you have any sense of the ratio that may exist between what the medical examiners know but can't report and what the DeSantis administration in Florida is reporting as their official figures?
Yeah, you raised so many good points there. We've been speaking with public health experts, and many believe that the death tolls that are being released right now, the death counts that are being released, are a significant undercount. And for a whole lot of reasons, to your point about some people dying at home, in different states, that does not figure into the official count for whatever reason. Or just the sheer fact that when this epidemic started, back in, we talk about February, the beginning of March, perhaps people weren't looking for it. So many people who died of what was believed to be influenza or pneumonia earlier in the year, those may have actually been COVID deaths. The situation in Florida is kind of unique. Because the way the medical examiners are keeping count of the dead, they are classifying deaths based on the county and state in which the person died. The state of Florida is only classifying deaths for Florida residents. Why does that matter? Well, in Florida, at this time of year, we have a lot of snowbirds. There are hundreds of thousands of snowbirds and seasonal residents in the state of Florida. who may pay taxes and, list other states like New York and Ohio on their driver's license. But there could very well be situations where those people got infected in Florida and died in Florida, and they are not being reflected in the count that's coming out from the State Department of Health. The health department says there's an epidemiological reason for not including them in that count. But some of the public health experts that we've spoken to have said, look, if you exclude that group of people, from the overall picture in Florida, and, given that that's a very vulnerable group of people, then that's not painting the full picture of what's happening in Florida right now.
And again, I'm speaking with Kathleen McGrory, who's Deputy Investigations Editor at the Tampa Bay Times, whose writing has exposed a previously unreported spike in the number of child gun injuries, traced the origins of a fatal power plant accident, and uncovered mistakes at a prestigious children's hospital. And her latest article at the Tampa Bay Times is Florida medical examiners were releasing coronavirus death data. The state made them stop. So Governor DeSantis, of course, recently met with the president in the Oval Office. There was talk of opening up the schools. Of course, Governor DeSantis has come under a lot of criticism for really delaying the lockdown in the state of Florida and allowing spring break to, people to not practice social distancing. At the very least, we all saw the pictures of teenagers, etc., having a good time on the beaches of Florida. And then he's even made an exemption when he finally did move on social distancing and some form of a lockdown. He made exemptions for churches. He's come under a lot of criticism, obviously, and I believe in your state and perhaps from your own newspaper, has he not?
There has been a fair amount of criticism that he's come under. We know from reporting that I did with a colleague, Neil Betty, that Florida was not quick to put a lockdown in place, and you're absolutely right about the beaches.
So is there a connection here then of not wanting to release the full count of the deaths and being an advocate for opening up the country in the way that President Trump wants to? And today, of course, is the last day of the Trump administration's edict on social distancing.
Right. Well, I can't speak to his intent or the intent of the State Department of Health. I don't have that level of reporting, but there are some things that I do know and can say that are interesting. So we know from some terrific reporting in the Miami Herald that the State Department of Health, again, this is DeSantis's, agency run by his administration, did at one point in time reach out to the Miami-Dade County medical examiners and suggest, guide, ask, that they not release their death data to the Miami Herald. They pointed to a part of Florida law that exempts certain epidemiological studies from becoming public record. But the Miami-Dade County attorney didn't like that legal reasoning, as she believed that the death records in Dade County were public record, and she went ahead and released them anyway. She sent a letter to the State Department of Health that said, while we'd like to comply with what you're telling us, we can't unless you agree to defend us from any potential lawsuits. So we know that there has been some interference from the state. With regards to this particular list, the medical examiner's list not being released, I reached out to the Department of Health and asked them if they had anything to do with this decision. And they said that they had participated in some conference calls where they shared concerns about privacy of these records, but that they had not directed anybody to do anything, that there had been no formal legal advice given or asked for. So, we can kind of look to all of these other things that have happened, because I think it's providing really important context to your question.
But what do you think is going to happen tomorrow, for example? When do you think Governor DeSantis is going to open up the state in the way that the president wants other governors to do? And since DeSantis was just in the White House the other day, you could argue he might be the kind of canary in the coal mine here.
Yeah, well, we saw the governor had a big press conference yesterday where he announced his plan to reopen Florida. He said he was going to be taking baby steps and kind of conceded that those baby steps might not be as fast as people might like. Perhaps that meant as fast as the White House might like. I think you can argue that the steps he's taking are faster than public health officials might like. And those steps include allowing restaurants to open in limited capacity as far as inside seating goes, allowing some retail to take place. Bars, nightclubs, gyms will still be closed. Schools won't reopen. But yeah, Florida is kind of taking some steps right now, and that's why this is it's a particularly sensitive time. And information like this, the death toll, is critically important, both to the folks in elected office and who are making these public policy decisions, but also to members of the public who want to interpret what's going on and evaluate for themselves how they feel about these decisions. The timing matters here.
Well, it is obviously, this is something that the nation is wrestling with, and the polls sort of indicate that maybe the public is more cautious than some of these politicians, like Governor DeSantis. And they're not really clamoring to expose themselves to the coronavirus. And if we get more reporting following the work that you've done, Kathleen McGrory, in Florida on medical examiners not being able to report in the full count of people who've died from coronavirus, and then you add to that people who have died at home, and the national reporting indicates that the overall count in this country may well be between 10 and 20% or even more than the official numbers. And it's bad enough that we have over 60,000 and we have over 1 million people infected. In fact, we are a country that has about 4% of the world's population, and we have 1/3 of the cases and over a quarter of all of the deaths. So I can see why the full number might well be embarrassing. How do you see things proceeding forward now that you've broken this story in the Tampa Bay Times? Florida medical examiners were releasing coronavirus death data. The state made them stop. Do you expect Governor DeSantis to start revealing the full numbers? Obviously, the questions arise. Is he covering up the full numbers because he's anxious to open up the state? And obviously, an even greater death count would indicate that he should exercise more caution.
We're going to continue to push to get the numbers. By no means is this the end of our reporting on it. We are advocates for transparency, and we believe this is important information for the public to have. Whether or not they'll make this information available to us in the near term or the longer term, I can't say. But I do think, as far as what people need to know, it's important to have this context that there is another list out there, and yes, that may report more deaths than the official count, and perhaps factor that into the way you're thinking about the epidemic and the way you're making decisions for yourself and your family.
Well, Kathleen McGrory, I thank you very much for joining us here today.
I thank you for spotlighting the work and for the invitation.
Well, thank you. And again, I've been speaking with Kathleen McGrory, the Deputy Investigations Editor at the Tampa Bay Times, whose writing has exposed a previously unreported spike in the number of child gun injuries, traced the origins of a fatal power plant accident, and uncovered mistakes at a prestigious children's hospital. And her latest article at the Tampa Bay Times is Florida medical examiners were releasing coronavirus death data. The state made them stop. We're going to take a brief station break and back examining the war of words between the Trump administration and the Chinese government, which is degenerating into a blame game.